Hi, I'm Dr. Rob Cushman, the Acting Medical Officer of Health for Renfrew County and District Health Unit. I'm here again today to give you another important update on COVID-19 as we now are at the end of August and schools are opening. I'm proud to say that we've only had 33 cases in Renfrew County, and this is all because of your hard work. It's because of all the work you and so many other members of the public have done to ensure that we are safe, and I thank you for that. However, there is no time for complacency, and we've seen what can happen elsewhere and what can happen quickly. You only have to look for Australia, South Korea, and even to California, where things quickly got out of hand a second time. Now, what I really want to talk to you about is how we can open these schools and how we can keep them safe. Epidemiologists say that if you have one case per day per 100,000 people, you can safely reopen schools. Essentially, we've been having one case every 10 days, so we're in good shape. Schools are so important. Our kids, roughly 15,000 of them, have been cooped up since mid-March. Their education has suffered, their social lives have suffered, and even their mental health has suffered. It's time to start schools again. Furthermore, schools are an economic engine. People who work in schools need their paycheck, they need to pay their bills, and they need to make their contribution to the economy. And this applies to healthcare workers and everyone else. Schools are so essential to help prime the economy. And so this is another reason why we have to keep them open, not only for the kids, but also for the working parents. Now, our goal is to keep the virus out of schools, and if it does get into schools, to shut it down as quickly as possible. Over this summer, the health unit has been working very hard with the school boards and the province to ensure that our schools will be safe. A number of measures have been put in place. They are essentially what you are doing, but within the context of the school. Furthermore, additional public health nurses have been added to the schools so that they can do contact tracing and, if necessary, and do it quickly. Now, I want to remind you at this point that the virus travels and it travels into our community. So if kids are going to bring it into the school, chances are they got it from adults, from their parents. And this means that we, adults, working parents, all young adults, all adults, need to be extremely careful. We need to follow the public health guidelines, but we also need to limit the size of our bubbles and to pay close attention to our social interactions, parties and celebrations, for example. These can cause incredible undue harm. It also means that travel must be taken seriously, traveling out of the county, but also traveling into the county. My advice on travel would be less is more. But if you have to do it with extreme care. And as I said, this applies to visitors and family coming into the county. So you have to pay attention to not only masking, physical distancing, hand washing, but also what's the size of the bubble and how can you avoid large social groupings. As I said, weddings and celebrations and parties. This is really important, and it's what we need to concentrate on. No doubt there's a lot of anxiety and fear out there, but consider the following 5 points. And this is how I'm going to summarize. First of all, there's very little COVID activity in our community. Secondly, there will be lots of symptoms. The kids will have lots of runny noses and sniffles, but rarely will they in fact be COVID-19. And if you do have symptoms as a parent or your child does, get them tested. Thirdly, children rarely get seriously sick. And furthermore, younger ones don't appear to spread the disease at a higher rate as older children, teenagers, and adults do. So this is a very helpful thing for the primary schools, for example. Fourthly, our most vulnerable people, seniors, have been taking care of themselves well since this pandemic first came to town, and I'm convinced that they will continue to do so. So finally, I'm telling you that I'm very confident that we have the ability to contain the spread when it does pop up someplace with testing and with contact tracing. And as I said earlier, if you've got symptoms, get tested. So what does this mean? Well, I think the biggest challenge for us is going to be fear and anxiety. We have to prepare ourselves, we have to discipline ourselves, and we have to substitute vigilance and action, the right behaviors, for anxiety. I was reading a book the other day about Londoners during the Blitz, and how inspirational was that when you think of what they had to contend with and how well they did. And this can be inspiration for us. And certainly when you look and see what they did, I have no doubt that we can do what we need to do in the months ahead. Finally, in Renfrew County, we have an excellent track record. We're the envy of the province. We have the skills. I'm confident together that we can do this. We can keep the schools open. We can keep our kids learning. And we can keep clear heads in the process. Yes, lots of kids will have runny noses and sniffles, but only a few will have COVID. So this is what we need to do to focus on the task at hand to keep schools running efficiently. Together we can do this. And I look to you for help as we move forward with all our efforts to keep our schools open for our kids. Thank you.